Welcome to Exam Sale. This script outlines the test prep syllabus for the National Registry Emergency Medical Technician exam and what you need to focus on to pass. This exam blueprint is divided into 5 domains with exact weights you must know. Medical, Obstetrics and Gynecology is 29%, Cardiology and Resuscitation is 22%, Airway, Respiration and Ventilation is 20%, Trauma is 16%, and EMS Operations is 13%. Knowing these percentages helps you prioritize study time and practice scenarios that match the assessment style. The Medical, Obstetrics and Gynecology domain carries 29% of the exam and is rated hard with about 60 hours of study recommended and scenario-based assessment. You will learn comprehensive assessment and management of medical patients, including altered mental status, seizure management, stroke assessment using validated scales, and diabetic emergencies from hypo to hyperglycemia. The OBGYN portion covers stages of labor, management of preeclampsia and eclampsia, recognition of placental abruption and previa, emergency delivery procedures, and neonatal resuscitation with APGAR scoring. Cardiology and Resuscitation is 22%, also hard, with an estimated 45 hours of study and both conceptual and scenario-based assessment. Expect to study cardiac anatomy and pathophysiology, recognize acute coronary syndrome and differentiate angina from myocardial infarction, and understand congestive heart failure and aortic emergencies. You will also master resuscitation standards including AHA-BLS guidelines, AEDUs, high-performance CPR techniques, management of ROSC, and termination of resuscitation protocols. Airway, Respiration and Ventilation makes up 20% of the exam and is medium difficulty with about 40 hours of learning and mixed assessment formats. Candidates will learn airway anatomy and basic maneuvers like head tilt, chin lift, and jaw thrust, suctioning limits, and use of oropharyngeal and nasopharyngeal adjuncts to maintain patency. The ventilation section covers physiology of gas exchange, bag valve mask skills, oxygen delivery devices and flow rates, CPAP indications, and monitoring with pulse oximetry and capnography. Trauma accounts for 16% of the exam, is medium difficulty, and suggests about 35 hours of study focusing on scenario-based skills. You will learn identification and control of internal and external bleeding, proper tourniquet use, recognition of different shock types and stages, and principles of fluid replacement and temperature control. The orthopedic and soft tissue topics include classification and care of burns, management of open and closed fractures, splinting and CMS assessment, treatment of eviscerations and impaled objects, and head, neck, and spinal immobilization. EMS Operations is 13% of the exam, rated easy, with roughly 20 hours of study covering conceptual and scenario-based assessments. This domain emphasizes safety and scene operations with PPE, vehicle extrication, hazmat awareness, safe lifting and moving, and emergency vehicle operations. You will also study incident management and communications, including NIMS and ICS basics, MCI triage protocols, therapeutic communication, documentation, and legal and ethical principles in EMS. To finish, allocate your study time according to the exact weights and the recommended hours, and focus practice on scenario-based skills for the harder domains. Consistent practice, review of key protocols, and timed scenario drills will prepare you to perform under pressure on exam day.